All right. Welcome back from the group discussions. You have done well. So if I go to your group, the presenter put up the hand, then I call. So group one. Emmanuel's group, Jonathan is there, Margaret is there. Okay, Jonathan.
Okay. Thank you, Dr. Kenneth.
All right.
And good morning to my co-students.
Okay.
We are group one, and we are to present categorical variables. So categorical variables are variables that distinct groups or that distinct data into groups, that describe data into different groups, or that separate variables into groups.
Okay.
Example is marital status, names, labels, smoking status, eye color, level of education, and we have different types of categorical variables.
Yes.
So we have one normal categorical variable. Example, the normally place people into normal different groups. So example is our names. So your name can put you into different groups. Your age can put you into different group. Your sex can put you into different groups. Your blood group type can also put you into different group.
Okay.
Then we have the one that uses two variables to put people into separate groups. That is the dichotomous variables.
Okay.
For example, putting people into yes or no, A or B. For example, when you go to the primary school, we have class 1A or class 1B.
Okay.
Or in the hospital, we can say those in ward 1 and then those in ward B.
Okay.
So the 1 and then 2 will put you into different groups. Then we have another type called the ordinal variable. And then ordinal variable groups people into 2 or more separate groups. Example is giving answers like strongly agreed, and strongly disagree.
Okay.
And sometimes there can be more of such groups. So
that's
we have
beautiful.
people who strongly believe that this is good, people who says that it is just good, and people who strongly disagree that it has something to do with them.
Okay. That's better. I have questions though, but I'll ask them later. I feel one of the terms you were referring to dichotomous grouping.
Yes.
I think your second one. Okay. All right.
So we have the continuous.
No, for the categorical
yes,
groups,
please.
You want to give me continuous also?
Yes, sir.
Let me go to the other group and come.
Okay. Thank you, sir.
All right. So group 2. Richard, Celestina, Frederick, Grace, and Lydia. The presenter should put up a hand or call. Okay, Grace, your microphone is open, so you contribute.
Hello, sir.
Yes.
Is it my network or what?
I'm recording.
Hello, sir. Please, can you hear me?
Saying you.
Oh. Okay,
Grace,
so we looked at we looked at categorical variables and some of the examples in our field.
Okay.
And then per the definition we had, categorical variables are variables that differentiate one to the other.
Okay.
So we looked for the types of categorical variables, and we have the nominal, the ordinal, and then the binary. So with the nominal, it is not in any order or sequence. So example is gender. Are you a male, female, or hermaphrodite?
Do they also exist?
They are under other people, like gender, male, female, or others.
Okay.
So they hermaphrodite to fall under others.
If you keep on having other people under gender in Ghana, the other people will indeed come on. Or you have forgotten the other people also.
No, please.
So,
Okay.
Now, let's move on.
And then we have blood group. Blood group A, blood group B, or AB, or O. And then for ordinal is an order. So we have educational level. You can't move from primary and then go to SS. You have to pass through primary, go to secondary school, then you do your bachelor's, your master's, and then PhD. And then we have pain scale. It can either be moderate, mild, moderate, or severe. And then we have binary. Binary, we can group it into two categories. Are you a smoker or you are a non-smoker? Yes or no. So we look for the examples under public health nurse and as a midwife. Because in my group, we have PHNs and then midwife. So we look for age. For PHN, we have under nominal, we have vaccination status. Is the person vaccinated? Vaccination, is it up to date or not up to date? And then we have health insurance. Health insurance, are you insured or you are uninsured? And then we have ordinal. The ordinal, we rate it according to your health literacy. Do you have more knowledge about your health? It can either be low, moderate, or high. And then your physical activity. Do you have sedentary lifestyle, or you are lightly active or moderately active or very active? And then example under binary, diabetic or non-diabetic. And then as a midwife to example. Example, we have antenatal care.
How do you group it? Group the antenatal care.
Okay. For antenatal care, we have first a person coming to book A and C in her first time. Is he in which trimester is the person coming to book A and C? So we have first, second, and third. First, second, and third. So that one is in under nominal. And then we also have vaginal types of delivery. Is it vaginal or cesarean section? And then breastfeeding to exclusive or partial breastfeeding. Then under ordinal, the pain intensity. This one I think we've talked about it. Gestational age, early term, full term, or late term. And then under binary, are you a multiparal, a primiparal, or a multiparal? Your first time getting pregnant, or you've gotten pregnant and giving birth so many times. So this will bring us to the end of our presentation.
That's better. I have questions to do. All right. Now group 3. I bet Fosti Vallis, who is presenting on numerical variable. Yes, I better.
Thank you very much, Doctor. So we were to discuss numerical variables.
Yeah.
And then on the whole, what we can say numerical variables are they are the characteristics of the variables that can represent measurable quantities. And then they can also be expressed in numbers. So basically, that is everything about numerical variables. Then we come to the types of numerical variables, and then we give some practical examples. So for the types, we have two types, the discrete numerical variables and then the continuous numerical variables. So when we talk about discrete numerical variables, we are looking at the characteristics that we can count. So the countable or the finite values. For example, when you take a specific geographical location, let's say Cape Coast, we can count the number of people that were affected with COVID-19 within a specific period of time. So at the end of the day, we are going to count 1, 2, 3, 4, 5, and this is the number. So it becomes a discrete variable. Another example is we can also look at our immunization coverages because we have targets. We can count the number of, for example, if you take Penta-3, we can count the number of children who are eligible or who came to be immunized for Penta-3. So that also becomes a discrete numerical variable. Then we go to the continuums. Then we talk about the continuous numerical variables. They are the variables or the characteristics that we measure. For example, the height. So we measure the height. When you come to our field of study, we take the weight of our patients, we measure the height of our clients, we take the temperature of our clients. All of them at the end of the day gives us a number that we can put down, and we can group them under continuous numerical variables. Thank you very much.
You're welcome. Lastly, group 4, where Ban is. So, Ban Eric.
Hello, Doc.
Yes.
Good morning. And I think our presentation was similar to that of group 3. We're also supposed to deal with numerical variables and give examples to. So like my colleague earlier stated, there are characteristics that can be measured and expressed in numbers, or they are measurable quantities that represent specific amount of quantities. And we have the two types, the discrete, which is countable and can take a finite number of value or represent a countable quantities, often in a whole number. Example is the number of patients at a particular ward, number of vaccination administered, number of hospital visits, number of medication given, number of needle prick within a particular month. Then when we go to the continuous, that talks about an infinite number of values within a given range. The example is blood pressure above 140/90 millimeters of mercury, weight, height, body mass index, and cholesterol. So by analyzing numerical data, we can say that it helps we, the nurse, to evaluate the effectiveness of our treatment to a particular patient or client. And also, it also encourages us to do a research and evidence-based practice in monitoring the progress of our patient. So this is what we also look at.
Yeah, I think the 4 groups have done well. And you keep it up. Whether I have disagreement with some portions or not, what I'm happy with is your ability to look for example in your field. Your ability to look for example in your field. There were some places where there seemed to be a thin line of overlaps, but I'm okay with that because I'll continue to explain them. But you have done well, the categories given, except those under the categorical variables. You were giving me so many categories at times, which were at times confusing me. But I always come back to my original position. So the biostatistician is confronted with these 2 variables, which you need to see. These 2 variables. the categorical variable and the numerical. There are some instances you work with the two. There are some instances you work with the two. There are some instances your work will be full of categoricals. There are some instances your work will be full of numericals. It's always the kind of data you are collecting and what you intend to use the data for that defines it. But the critical moment of the life of the biostatistician is to see which of the data collected belongs to a categorical variable. It's important because your inability to see it means that you cannot employ the appropriate statistical tool. So the categories are normally variables that we place into groups, simple groups. All right, and you did well in bringing the others on board. For example, you brought the nominal and then the ordinal on board. Okay. The other groups, numerical, you also did well. You brought the discrete and the continuous on board. One example that makes me happy is the one who gave that number of patients in a certain ward, number of vaccines administered. They can be discrete, you can count them. But if it gets to maybe the whole of the country and others, it may confuse us. Okay. The only place I didn't get, the examples were good, but I didn't get is continuous. Okay. Let me explain the continuous this way. When you pick 2 points as a continuum between point 1 and point 2, what makes the data collected between point 1 and 2 continuous is that you can have 1.001, 1.002, 1.003, 1.004. You can also have 1.01, 1.02, and so forth, and so on. So if you understand that is how the nature of it is, you will know which tool is the most appropriate to use. As we move down further, those data that are collected in that perspective, the variables can also be seen as an interval or ratio. When it is an interval, means that whenever we say 0, the 0 does not mean that there's nothing there. It does have something there. So for instance, you could see those who visit the advanced world or the other countries, the Europe and others, in Africa here, South Africa, you can see it, can go to a temperature at 0. It doesn't mean that there's no temperature, there is there, 0 degrees Celsius. So the refrigerator or the freezer component of a fridge can keep a substance like water to a 0 degrees Celsius. That's reading exists. So as if it is a ratio, a variable is being considered under a ratio, means that the 0 is absence. It doesn't. It doesn't. So if I pick the weight and I say the person has no weight, the person has no weight. Okay. So those who spoke about body mass index, if we say his body mass index is this, it is that. So we need to appreciate them. But fortunately for us, in applying statistical ideas, we normally treat the ratio and the interval as the same when we are using the tools. It may not conflict. Whatever we use them for, we may get it. Now, one of the examples you give was also contradicting ordinal. Good. And that's where at times where the danger is. One of you gave me, let's see, agree. I think he gave 3 levels and say can continue. I thought I captured it. But there was an agreement. No, he did not go for 5. The person went for 3. I think there was an agreement, disagreement, and a mate before he said that it can continue. Okay. It looks ordinary. It looks ordinary. And that's where problems are. When people use an instrument called questionnaire in collecting data, should we consider the data collected as continuous or ordinary? When you go read about it, some people believe that when you use a questionnaire, you are dealing with an ordinary data. Some of us believe that it's continuous. So you can go to check and see the arguments there very well. Though it was a 3 points, but it can be. Those who use the yes and no's, you have done well. So these are my explanations for them. The examples you gave were good. They were good. And they fall within what I have, the sex of the patient, the color, the body odor, okay, the height of a patient, the weight, the BP can be good. Now, this brings us to a particular point under variables we call levels of measurement. A good biostatistician who is efficient at what he does or she does should know the levels of measurement he or she is dealing with. Okay. Godwin, you have a point. You say, actually, I actually have a bad network though. I would be glad to get the recorded version of the lecture. That is available and it will always be available. Just hang on. You'll be fine. Okay. So you need to know your level of measurement is important because all the tools we use operate at a certain level of measurement. All the tools. So there are 4 levels from here, from where we are coming from. There are 4 levels of measurement, and these are nominal, ordinal, interval, and ratio. Nominal, ordinal, interval, and ratio. 2 of them coming from categorical, the other 2 coming from numerical. So you should know which level of measurement for this variable was the data taken. So nominal, as I've indicated earlier, only categorize. Anything you assign to it does not imply. The examples you gave earlier are good. Gender of a health worker, male, female, does not imply anything. Ethnicity. In Ghana here, we are a lot. And the beauty of our system is that we understand where we are coming from and we are living with them. Yes, come. Yeah, sorry for that. So we have variety. So the mere fact that maybe you are from the account domain, the Ghana Dangle domain, doesn't make you somebody special. Okay, so it doesn't imply anything. It's just groupings we have done maybe to make a good understanding of what we are doing. The ordinal is a nominal with rank This understanding is where normally it eludes a lot of people. The ordinal is a nominal with rank. Any ordinal data can be considered as a nominal. But here, whatever thing you have done to it has an implication. So if you say 1, indeed 1 is 1. If you say 2, indeed is 2. It's not just a category 1 or category 2. It implies. So if you look at the examples I have here, language abilities of community midwives. They can be in different communities. You may not understand their communities. The way they say you don't speak well. Somebody speaks well. Somebody understands the language. It implies, oh, this midwife there, when you speak, he doesn't hear and understand you. It implies, oh, the other one can understand. Job satisfaction. It implies some are dissatisfied with their job. Others are satisfied with their job. So here you see we can have 2 categories. Those who are dissatisfied, those who are satisfied. Yes. But it implies that somebody is not satisfied. It implies that somebody is satisfied. So it's an ordinal, and the ordinal is nominal plus rank. When we go to the next group or level of measurement, interval is nominal, ordinal, plus the spacing. Where in simple, general social science terms, you see the 0 does not mean absence, but there's a certain conscious spacing, which is even. So the data can be categorized, ranked, and evenly spaced. An example is your test scores. If I conduct a quiz in advanced biostatistics, what you score can be considered as an interval. The temperature in either the Fahrenheit scale or the Celsius scale can be considered. Lastly, is ratio. It means that it is nominal, ordinal, interval with 0 being 0, an absence of something. So the data can be categorized, ranked, evenly spaced, and has a natural 0. For example, the height of 1-year-old children, weight of newness, temperature in Kelvin. So normally people mistakenly straight away put temperature under interval, but when it is measured in Kelvin, it's a ratio. Any question? You put up your hand, I'll call. They will discuss. Any question? Kate, do you want to ask something? You have not been stable, but ask. But next time, put up your hand. The reaction is there. Use it. Yes, Kate. Shall we move on? Kate, your microphone shows that you are talking, but we cannot hear you. So check your device once again. Check. All right. So there was a cloud. Thanks. And there's a question hand now. Okay. First thing.
Yes, sir, please.
Hello, sir.
I want to find out.
Yes.
I want to say that.
Please.
Can we say that?
No, Kate,
under
wait.
The level of measurement.
Yes.
The interval has all the 3, let's say, factors or description.
All the three levels plus the zero.
No, I mean the interval. Under the level of measurement, you have the nominal, the ordinal, the interval.
Okay, yes.
Can we say that the interval has a bit of nominal level in it, a bit of ordinal in it?
That's the point I'm
then
making.
The ratio has all the four.
That's the point I'm making.
Okay, you.
So whenever you have a variable that is ratio, means that the researcher can consider that same variable as a nominal when need be. The researcher can consider that same variable as ordinal when need be. The researcher can consider the same variable as interval when need be.
Okay. Thank you very much.
You're welcome. So that is the point where if you are not careful and you haven't read the work very well, you straight away say you are wrong. You straight away tell the person you are wrong. And that is why variety of biostatistical tools are there. So immediately the one using it defines its position very well. The person may be permitted. Now, Kate, if you can give your point. Okay. Then I move on.
I'm okay.
Yes.
I'm okay, please.
Okay, that's better. All right. So we move further with it. Okay, we move further with it. And this is where I need you to come on board. I said, think through this. What do these levels of measurement inform us? What do these levels of measurement inform us? This time I'll give you 10 minutes. You go back into the groups. I'll reform the group because others also joined so that they can be part, but it will be 10 minutes. What do this level of measurement tell you as a biostatistician, somebody who has collected data and you want to manipulate? Look for answers to it. What do they tell us? Spend just 10 minutes to think through this and come back. Jude T has also not been stable, but let's admit her or him. So this time the groups, there are 5 members, one being 4. Go and come, we use 10 minutes. And that will be sufficient. All right, welcome back. Welcome back from the group discussion. So now we'll start with group 4. And then the members in group 4 are Frederick, Eric, Richard, and Abigail. Yeah, what does this inform you? Knowing the levels of measurement. Why do I need to know it? The presenter should put up a hand and then I'll call. Okay, Frederick, your microphone is on and you're in that group. Oh, I should move on. Now group 3. Abeta, Ban, Emmanuel, and then Margaret. Why should put up the hand and then I call? Wow.
Hello, Doug.
Yes, Abeta.
Okay. So for our group, what the levels of measurement informs us, we were able to put down some few points that we want to share.
Okay. Yes.
So the first one is, we say that it informs us where our interventions are needed.
Okay.
At the end of the day, it will tell us if we have to concentrate on maybe teenage pregnancy, where we need to put in more interventions. The level of measurement would inform us where necessary. And then another point is that the levels of measurement would also help us to measure the effectiveness of the interventions that we have instituted, to see if we are on track, if we need to re-strategize, if we need to go and come again, and all that. It also helps us to measure our performances, our achievements, where we are as a unit or as a department. The levels of measurement will also help us to measure our performance. Another point we were able to come up with is that the levels of measurement also helps us to know the most effective type of data tool to use for a particular, to address a particular problem. If you
Your last point
understand
again. Let me take that as your last point.
Okay.
Restate it.
All right. The levels of measurement helps us to know the most effective type of data tool to use.
By data tool, what do you mean by data tool?
My group members, are you with me?
Data tool, what is it? And that's why I say restate it so that I pick a point from it. Your group members, they have let you alone. They have all run away.
God, you are with me. My group members, please come and save me from the,
yes, Emmanuel.
From the ocean. Emmanuel is on the floor. Thank you.
You're welcome. Yes, Ima. What do your group meant by data tool?
Ima, please, you have our audience. I don't know if your mic is muted. You can unmute yourself. Doctor wants you to make a submission. Thank you.
Okay,
Yes.
say, okay, Doc. Yeah, I'm on it. So
Okay.
it will just guide us to know the choice of statistical analysis that we want to use. So the level of measurement dictates which statistical methods are available. For example, using a mean for a nominal data would be inappropriate, while a median might be more suitable for ordinal data. So it will just guide us to know the choice of statistical analysis that we are going to use. That is what we mean. Like that is what we want to say.
A data tool. I thought the data tool was an instrument that you are going to use in collecting the data.
We didn't actually mean a data tool. We actually meant a statistical analysis rather than a data tool.
That's all right. That's all right. That's better. Group 2, Celestina, Faustina, Judith, and then Kate.
Hello, Prof.
Yes, Celestina.
Analysis rather than a data tool.
Please, Ima, can you please mute? Please, for group 2, we actually had some network issues, so we didn't have more time to say a lot of things, but we were able to write few things. As in looking at categorization, we realized that it cut across all the 4. And so we realized that it was important for us to categorize our data. And then also we also said like it will help us to compare compare the data and then know which one suits the research that we are doing. Before the session ended, Faustina was about to say something, and maybe she can add that one here. And
no, when she asked, it wouldn't be for the group because the group has not agreed on it.
Oh,
the
okay.
one that the group has agreed is what you have presented. Is that not it?
Yes, please. Yes,
Good.
Doc.
Well, that's the weaknesses of cooperative learning approach. Even if you have a beautiful idea and the group does not agree to it, it doesn't stand. You get the point.
Yes, Doc, can we agree here, my group? Can we agree on this name?
No, that one you are using our group to discuss. So your points are okay. I think they are exhausting. You have done well.
Okay.
All right.
Okay, thank you so much.
Good. Only group 4 exhausted their opportunity. They couldn't contribute, but I am happy with the points given. All right. I think you did something. The actual point. Yes, Eric. If you are presenting as a member of group 4, your time has
elapsed. Please, we didn't hear you calling.
Hey, this one is too sweet. I call several.
Oh, okay.
All right, you present now. Now that you say you didn't hear there, you present. Okay. All right. We are listening, Eric.
Okay. So we'll look at the measurement.
Okay.
Okay. Please, we looked at the measurement level and using the symbol that was.
Adjust more your position. In the same place, just adjust yourself.
Our clients or patients. And 2, it also informs us to know whether a particular intervention is having a positive influence on a client or not, so that it can inform a research-based practice to either correct it or to improve on it to help solve the issues of clients regarding their health. So this is a little that we as Group 4 also put together to present.
Okay.
But so we didn't hear, we thought it was start from Group 1, 2, 3, 4.
No, I change who present first. If not, there are instances those in Group 4 will always be a victim. By the time they present, their points have been exhausted by another group. All right. So good. I like the points raised, but levels of measurement typically is important in everything we do as a biostatistician. I have these few points to highlight. Some of them fall with the ones you have given. The different levels limit which descriptive statistics can be used to get an overall summary. One of you gave points. Says that if the data is this, you may go for a mean or median. Even descriptive tells you. So as in inferential, it tells you which one you can perform or not. It also tells you the question that one of you asked, I have forgotten the person. That am I saying that if you pick interval, nominal, ordinal is there? Good. And this is your point. In many cases, variables can be measured at different levels. And this is where those doing research needs to read their literature very well to appreciate what they say they are going out to look for. Because some variables can be measured at different levels. So hence, there's the need to choose the level of measurement before data collection begins. That's my vital point. You can't just go and collect the data and come and say that I'm doing analysis. So when we were students at master's level like this, I remember one professor said that those days, the computers and the analysis were not common phenomenon on the soil of UCC. So those who know here, behind ATL and others, we in the old side, you go there, a young guy, a young lady is sitting beside the computer. And then ask the person, can you do some T test for me? Can you add some chi-square for me? Can you do this? And then they'll be laughing at us. You cannot go and say, do this for me. You need to make that decision before you go and collect the data. You need to decide which level of measurement am I taking this data before you go. And this is when normally people like we being students have conflicts with our lecturers. There's a why say anything you send the person who can say anything. Maybe the level of measurement you're even taking is what which is common. People have seen it. We don't need it anymore. So these levels of measurement can view. Sorry, I don't want to highlight that point first. So I conclude on this point that a good biostatistician do not just collect the data and come and analyze. Decide on which level of measurement before going out for the data collection. You need to decide which level of measurement. If you have questions, you ask. But as I'm approaching my main target for today, is that when you know your variables, you know your level of measurement, there are two important things. These variables communicate to the statistician. Either you see it as dependent or independent. The dependent one is affected by the manipulation of the independent. The independent is the one that is manipulated, and then the effect is seen. Who is off? Okay. The independent is manipulated, and then we see the effect of it. So I have this flow, a flow chart, something like that. For that, I have my independent variable, administration of a certain vaccine, a new drug, and I want to see its effect. So we come to where influence or changes occur. And this influence is on the dependent variable, which you always need to see them. So I gave this example, which can be seen at the Scriber online. It says that there's an analysis of the dependent and the independent variables. So that apply different levels of the independent variable. Somebody is making a study. You want to see how the thing will affect something. Yes, coming. Please, I'm coming on.
Okay. So a researcher is interested to see whether a medication would have an influence on the blood pressure of some patient. So looking at these two, which of them do you think would be the independent variable and the dependent variable? Is it the medication or the blood pressure? I want contributions. So we are saying that the independent variable would influence the dependent variable. It will cause a change in the dependent variable. So looking at this example, that's the medication and also the blood pressure, which of them would be the dependent? Which of them would be the independent? Yes, Faustina.
Hello. Hello.
Hello.
I think.
Hello.
Yes, Faustina, you can speak.
Yeah, so the new medication will be the independent, and then the change in which will cause a change in the blood pressure. So the blood pressure becomes dependent variable. Thank you.
Thanks for the point. Okay. I have something here from Madrid. You said that the medication will be the independent as it affects the blood pressure. And then Celestina, you have a point that medication will be the independent variable. All right. So the medication will be, and I think the person is studying too. You are in the head, but you may disagree with the sugar pill, placebo. You may disagree with it, but it's like it was the one that was there before a new one was introduced. Okay. So when it is given, we are expected to see the effect. When the new medication is given, we are expected to see the effect. One of them gave an effect. The other one, there was no effect. So we measure the effect. So the level of medication could be studied as two. One being acted here as a control group or the other. So that becomes the independent. And then the effect we experience, which so far the test you have said, nobody has mentioned what the effect is. For the independent, you have seen that it is the medication. The medication is the independent, okay, from Eric. And then the blood pressure is the dependent. That's beautiful. So from day one of you coming to analyze the data, you need to know this. Which one is the dependent and which one is the independent? So normally, most of us use the nominal as the independent. But some statistics, the ordinal can be the independent. The continuous can still be the independent. So you need to see, and as I've mentioned from the previous slide, that different variables take different forms in terms of levels of measurement. The biostatistician needs to be alert on this, before manipulating the data. Any question? Any question? And then on we march on. Okay. So I have given these scenarios or situations that it should occur to you after taking the measurement to decide which one. If the variable is manipulated by the researcher, if it is manipulated by the researcher, and then it's the independent variable. But if it is not manipulated, it is the dependent variable. If the variable causes an outcome, then it is the dependent, sorry, the independent. If it does not, it is the independent. Sorry, I take it again. If the variable causes an outcome, if the answer is yes, it's the independent. If does not, it is the dependent. The last way we look at them is that is the variable the result of another variable? If yes, it is the dependent. If no, it is the independent. You always need to have this understanding before you can be an effective and efficient biostatistician. It looks simple, it looks elementary, but it's the pillar with which we manipulate data to communicate something to the world. Those who do not treat them with all the utmost respect always struggle with the data they collect. So a lot of persons will have rich data, but they may not handle it very well. The worst case they can do is to give you some percentages, some this, some that. Okay. Now I give you a typical question, which can be a research question. Do I don't like does, do, is in my research question, but it's an example I found. Does the presence of specific pathogen affect the severity of a disease? This is a research question. I am collecting data to analyze and answer in my work. So you look for the two variables, the dependent and the independent. And if possible, you tell me the level of measurement you will use. I don't know if that is my activity after it. Yes. You tell me the level of measurement you use. This time too, I want it to be group. I'll maintain 10 minutes. It's not too much of attacks. I'll maintain 10 minutes. If you have questions, ask before you go. If you have questions, ask before you go. You need to understand the dependent and the independent variables. They can be at any of the levels of measurement. And if you place them at any level of measurement, it tells you which statistical tool is most appropriate. So I've given this research question that to you, where does it fall? What is your dependent? What is your independent? And that's for you to be active. That's why you go to the group. When you come this time, there should be different presenters. Oh. There should be different presenters. So go and come.
They are not assigned. Oh, yeah, so.
I thought that they were not assigned.
One.
It deceived me. Sorry, there was an error. I thought most of you were not assigned to the group, so I redo it. My apologies.
Yeah, welcome back.
Thank you.
Thank you, sister.
Thank you.
All right, so let's hear from group one. For group one, we have Bernard, Grace, Jonathan, and Kate. Who is speaking on behalf of the group? Bernard, Grace, Jonathan, and Kate. Okay, Jonathan.
So we also saw that the severity of the disease is the dependent variable, and then the independent variable here is the presence of the pathogen. And when we want to employ any research method, we can use the nominal research method because it's an nominal with rank.
Jonathan, please, it's ordinal, not nominal.
Yeah, ordinal because it has a nominal and a rank. Thank you.
Group two, Aban, Celestina,
Yeah.
Posty,
Thank you,
Judith,
sir.
and then yes.
Thank you very much. So group two, we try to look at what an independent variable is. And then we agreed that it's one that's
Adjust your position slightly wherever you are.
or unpleasurable one, of course.
Posty, can you take your point once again?
Okay, so let me come. The one that can be categorized and observed its effects on the dependent variable. So I'm saying that the effect could be pleasurable effect or unpleasurable effect. Okay. Hello?
Yeah, we are not getting the point because your end was not clear. Can you take the point again?
Hello?
Yes, go ahead.
So the pathogen becomes the independent variable.
Okay.
And then the dependent variable. And in its measurements, we can use the ordinal because the ordinal have been categorized as mild, moderate, and severe.
Okay. All right, group 3. Alberta, Emmanuel, Margaret, and then Valis. Ima. Ima, I'll mute and then give your point.
So what I was saying is that we were able to come out with ours, the independent variable. We identify the presence of the specific pathogen. And then for the dependent, we also identify the severity of the disease. The level of measurement, we actually identified that we can use the ordinal measurement to actually categorize the level of the measurements, being mild, moderate, and then severe. And one thing we actually find was that we could have used the ratio or the interval. That is, if there was a specific clinical indicator, example, let's say the percentage of an organ function lost was attached. For that one, we would have opted for the numerical one using the ratio or the interval. Thank you, sir.
All right, I pick your point, but severity too can be on the continuous scale. You can measure severity on continuous scale without the things that you say should be there. You can. The presence of specific pathogen can also be on continuous scale. We're talking about presence. There can be an instrument that can be used to measure the presence. Those of you, let's say the lab tests. I'll come to group 4. The lab test we do on then the viral load. Can't you count it? Or you don't say that viral load or bacterial load or what? I hope you have that term there. It's a count. So it can be on continuous. Let me go to group 4. Richard, Eric, Frederick, and Justice. Yes, Frederick.
Okay, sir. Thank you.
You're welcome.
So, group 4, we also agreed on the specific presence of a specific pathogen being the independent variable.
Okay.
And then the severity of the disease will be the dependent because that will be the outcome being measured on the presence of the pathogen.
Okay.
And then the level of measurement, pertaining to the severity of disease, we agreed on the ordinal level because they can be ranked either mild, moderate, or severe.
Okay.
And then the presence of the pathogen too, we agreed on the numerical, which we said an example being the malaria parasite, which we can measure the number of parasites and then how it causes severity in the malaria.
Okay, that's better. So you see, this one takes us back to the point I've made earlier that the statistician need to be.
You also agreed on.
Okay, the statistician need to understand what he has first or she has first before moving on. I feel I have had this analysis here, the independent variable in it. The independent variable is one that is manipulated or categorized to observe its effects on the dependent variable. So in this case, the independent variable is the presence of the specific pathogen we are dealing with. It can become categorized as presence or absence. So the categories is 2. The dependent variable is the outcome that is measured to see the effect of the independent variable. In this case, it is the severity of the disease. So the dependent can be measured in several ways here. If my work I'm doing is clinical symptoms that I'm looking for, it can be mild, moderate, and severe. If I'm basing my arguments on laboratory markers, levels of certain biomarkers may be used. It can give you something different. If patient outcomes, recovery, and mortality can also be used. So if you check that question there, various forms of data can be collected and various forms of statistics can be performed. And hence the need for the researcher to make the decision, the need for the biostatistician to make the decision prior to the data collection and the analysis. If you don't do that, it will not help. So you have done well. If we check the 4 groups, you could see that the levels of measurement were differing, meaning that we can do the same work, supposedly, but we'll be looking for different things. And that is vital. Okay. Your ability to see the dependent and the independent variable. Good. Now we move on to the levels of measurement. You need to define these before you proceed with it. So there are so many forms. If I keep on, I'll be engaging you and engaging you and engaging you. So I say think through this, look for another research question on your own. Analyze the variables into dependent and the independent variables. But we are ending the lecture. So I have given another example. How does social support influence the self-efficacy and diabetes distress in individuals with 2T, T2DM? Yeah, type 2 diabetic mellitus, something like that. So how does the social support influence the self-efficacy and diabetes distress in individual who is categorized as a T2DM? You can respond. What are your dependent and independent variables? We are ending the lecture. So you put up your hand, I call you. I feel you have had training enough. So now you should be able to locate them. Yes, whose hand is up? Where are your dependent and independent variables? We have about 20 minutes to go. Let's say 10. Oh, I was looking for a quick response because of so far the examples we have seen. All right, Judith. From there, go to Greece.
Yes. I'll take social support to be the variable that the researcher can manipulate.
Okay.
And then that of the self-efficacy and then the diabetes distress. They are dependent on the social support.
Okay. Okay. Yes, so Greece. Go on.
The social support now becomes the dependent variable, whereas the self-efficacy and then the diabetes distress becomes the independent.
Why have you
I'm saying
changed
this
them?
because
No, wait. Why have you changed them? Because that is not your original statement. Originally, you said that the social support is going to be manipulated. And then the outcome is what we are going to see as self-efficacy and diabetes distress. But in your attempt of calling them dependent and the independent variable, you have changed them. So if social support is going to be manipulated, what is the identity of the variable?
That's the dependent variable.
Social support being manipulated.
So then it becomes the independent, sorry. It becomes the independent variable.
Okay. That's better. You almost changed the whole thing, what you have done.
Okay, thank you.
You're welcome. All right, Grace.
Okay. So I'll also say that the diabetes is the independent variable. Then the social support is dependent variable.
Your justification. Okay.
Sir, please, I'm starting.
All right. If you'll be back, I'm happy. Yeah, from justice from your end, you say social support is the independent variable because it can be manipulated. Okay. And I say self-efficacy in type 2 diabetes management is the dependent variable. That's why it did not give me the reason why it is. So it did not give me a reason, but that's all right. Grace, your hand is still up.
Please, it's the old one.
Thanks. I'll lower it for you. Okay. I am ending today's lecture by telling you that you need to appreciate these variables. So I say the independent variable here, which those who spoke, those who wrote the chart, you did well, is a social support because it is the variable being manipulated or considered as the influencing factor. Because it's not all the cases that we manipulate. It may include various forms of support. It can be emotional, informational, tangible support. So somebody can do this study, but may looking at emotional support, informational support, or tangible support. They can be different study. And that's why, once again, reading literature is important. Now, the dependent variables can be self-efficacy. That is, the individuals believe in their ability to manage their diabetes effectively. It can be there. It is influenced by the level of social support they receive. Or diabetes distress. That is the emotional burden and distress associated with managing diabetes. It is also influenced by the level of social support. A good biostatistician who wants to be efficient needs to understand these concepts and use them very well. I end with this assignment, which you do and then you submit. I say, at least you say next week we'll see you face to face. I normally want the assignment to be in groups, so you maintain the groups that you have so far. We ended with the 4 groups. So I hope you know your group. When somebody is not here, don't add the person. We are only few here. They don't add the person. So analyze 5 research publications in your area of specialty in Master of Nursing. Now I'll add the public health on attitude and perception skill under categorical, discrete, and continuous data. The next week, Tuesday, you submit either in a typed or a written form. Typo is good. Type and print. I hope you remember your groups. So we maintain the groups. Yeah, if there are no issues, let me end you here. You go and take lunch.
No, please, if the last group, because today we went into 3 sessions, if the last group can be sent on.
Okay. So you need the last groupings. I think there's nobody who is outside the group. There's nobody. So my group 1 members, they are Bernard, Grace, Jonathan, and Kate. Group 2, somebody has fallen. Group 2, Ba, Celestina, Faustina, and then Judy. Group 3, Alberta, Ima, Margaret, Vallis. Group 4, Richard, Eric, and Frederick. Somebody has fallen. So when the person comes, we'll add the person. There's a chat here, I'm checking it. First, he said, Doc, please, the group again.
I think it was Abigail.
Yes, Abigail should be in one of the groups.
I think it's Abigail.
Yeah. If the group members remember, you add her to the group. Okay. And then I think today, Jano, Kofi Gordon was around. He should also be in the group. He has been here. Justice has been joining and falling. He should also be in group. Hello, Joyce. I want to, let's maintain the groups. If not, I wanted to recreate them. Or what do you suggest?
Doc, I think we will maintain the group.
That's better.
And then, if possible, those who were falling on and off, if we can add them up, then we'll get their names so that when we are doing the presentation, we can add.
Good. They should remember just the group that they were in so that we only add them to the groups.
Sir, there was one guy, Isaiah. Isaiah too has fallen, but he was also part.
Yes. Yes. So if Isaiah was in your group,